Welcome to another edition of Johnny Investing. Other people trying to sell you something. I'm just here to find those A winners, go-getters, trend-setting companies to invest in. Thank you for joining me wherever you may be. We got a great show for you two today. We're talking about an exciting company called Mersana Therapeutics. Please read the disclaimer on your own time. So Mersana Therapeutics, this is a big biotech pharmaceutical company, and they're specializing in developing antibody-drug conjugates, ADCs for short, therapies to treat cancer. So this is really exciting. Leadership team, another outstanding executive leadership team, and Protapas is the chief executive officer. If you're not familiar with Takata Pharmaceuticals, she was basically the person that ran that oncology business, which is over $1.3 billion. Did an outstanding job with Takata Pharmaceuticals, and she's doing a great job so far as CEO of Mersana Therapeutics. So let's go right into the pipeline. So basically, Mersana is developing they're trying to differentiate by creating these antibody-drug conjugates. A really pretty unique type of approach. So they're both cytotoxic and immunostimulating. So that's supposed to be really exciting. Hopefully, some of these they're big platinum-resistant ovarian cancer indication for ovarian cancer is their upfidimab, risodontin. Those two, they got some big trials going on, a pivotal phase 2 trial and a phase 1. They're doing a dose escalation, and they're also in a phase 3 for reoccurring platinum-sensitive ovarian cancer maintenance for the indication. So they're basically using this ADC, antibody-drug conjugate, to overcome some of the limitations of first-generation therapeutics, which lower efficacy, worse tolerability. And if they can address these kind of unmet needs, really can help a lot of cancer patients, and I really hope they get some positive results. So this could be a first-in-class drug to treat ovarian cancer. They have some pretty promising results coming up, so I'm going to definitely keep an eye on it. In the end of quarter 3, 2022, their primary endpoint, is basically they're looking at overall response, ORR, overall response rate. They got, I think, over 100 patients already enrolled. It's all ready to go. Hopefully we'll get some good results coming up. And let's look at the other medication that I really looked at. I think they just got orphan designation of the XMT-2056 for HER2. So that's another one. That's also in phase 1 trial. That's XMT-2056. So that's exciting too. So I'm going to definitely keep an eye on this company. So let's look at the stock price. Mersana Therapeutics, the stock symbol is MRSN. It's trading at the time of the video $5.25. I still like this company. I do think, though, because of the economic period we're in, it could get cut in half. Could get cut in half to maybe $2 range, and that's the point where I'm looking to get in. I still think they got a lot of opportunity. I still think this company can go up 10x, 15x. They have a big agreement they announced in their beginning this quarter recently with GlaxoSmithKline. I like biotech companies that work well with other companies, and they have a global collaboration with GlaxoSmithKline, big player, with that XMT-2056. I believe Mersana will get $100 million upfront option purchase fee of $100 million, and can receive up to $1.3 billion. And if the option exercised, and if it goes through development, and they reach different milestones. So that's pretty exciting news. I'm definitely going to keep an eye on this company. I still think there's a potential upside for Mersana Therapeutics. That's all the time we have today. I hope you enjoyed the video. If you did, please make sure you hit the like and the subscribe button. Hope you have a wonderful day.